We are engaged global citizens of pain. We're here to enjoy each other's company over the next few days. And with that, I'd like to officially open this meeting. Thank you.
I do think there's another question that has begun to emerge in the last couple of years, and that is the question as to why the burden of pain should fall so disproportionately on individuals. So if you look at society at large, if you go to a pain clinic, you're very well aware at how unequal the pain burden is. Some people seem to suffer disproportionately for the amount of pathology that they carry. And so I think a very modern question that is important clinically to answer is, why is it that some people seem to be particularly vulnerable to developing chronic pain states while others seem to be much more resilient?
Then you see that in a part of the patients there is still neuropathic pain. In a part of the patients there is still neuroplasticity. In a part of the patients there is still endothelial dysfunction. You see these different phenotypes of CRPS. So it can be fulminant. It can be a patient which presents especially with vasomotor disturbance. It can be only neuropathic pain, and it can be dystonia, or it can be a combination of this.
And again, the impact is that the parent gets to see that they, first of all, have the ability to work on something in their own life, not just their child's, but also that they can be successful in breaking something down and really seeing it through.
So in the recent topical review, we argued that both risk and resilience mechanisms should be considered in pain research and treatment. We also argued that in addition to negative outcomes, such as disability and depression, also positive outcomes should be studied and targeted in clinical interventions.
And I think that really underscores the notion that part of the outcome of every therapy, particularly in pain and certainly in drug therapy, is the effect of the drug, but the effect of that therapeutic encounter, that ritual on the patient's brain.
And every one of these opinions will be important, whether it be patient, colleague, family. And that what you would bring out of that would be collaboration, would be educating each other, the patient educating me about their experience, me passionately bringing them everything that I know now, the neurophysiology, the psychiatry and psychotherapy, the physiotherapy that would help them to come through this most painful of journeys.
We know that musculoskeletal conditions are rising with the increase in the population as well as the ageing population, and there's really an urgent need to prioritise better healthcare and research in this area.